Hi, it's Dr. Vo from East Bay Pediatrics. I wanted to check in with everybody because so many kids are sick and coughing right now. We've got COVID, we've got flu, everybody's hearing about RSV, even though most of the time we're worried about RSV in very young babies. But what I could do for you right now, since I know it's hard to get through to us on the phones, is give you a brief tutorial on what to look for and when to call. So let's think about coughing and breathing problems. When your child is sick, your child may breathe fast or breathe loud. We're really worried when your child is working hard to breathe. What does that look like? I have a video here. The baby will work to use all the muscles of the chest and the abdomen, even in the neck. You may see the skin sucking in between breaths. This is a sign of working hard to breathe. If your baby's changing color, like at the end of this video, you should already be on your way to the ER or calling 911. But most children are just working hard to breathe. So when this happens, what should you do? First, try to clear the mucus. A lot of times babies and young children prefer to breathe through their nose, and when they're asked to breathe through their mouth, they'll work harder to breathe. So use a little saline drops, suction the nose if it's a baby or toddler, or get the older kids to blow their nose. Check for a temperature. Sometimes when you have a fever, you breathe faster and you pant. So kids can look like, if you can bring the temperature down with Tylenol or ibuprofen and the breathing improves, you don't need to call. You can use the chart on our website to figure out the dosing for Tylenol or ibuprofen if you need it. What else can you do? If your child already has asthma or a history of wheezing, you may have an inhaler at home or a nebulizer. Go ahead and use the medication. See if it helps. That medication, albuterol, relaxes the airway and opens it up so that asthmatic patients can get more mucus out and breathe easier. Don't be afraid to use the medication if you have it. So in quick summary, what should you do if your baby or child is coughing or seems like they have breathing problems? First, try to clear mucus. Then check for a temperature. If your child uses asthma medications, go ahead and use the medication and see if they improve. If your child doesn't improve, yes, please call us. We would like to try to see if we can see your child and make sure there's nothing else going on.